I want to follow Leader McConnell and Senator Crapo on their comments concerning Medicare. I don't think there is a state, Mr. President, that's more affected by these potential cuts to Medicare than my home state of Florida, where we have nearly 3 million Floridians who enjoy the Medicare program. Ultimately, the question on our health care debate is how we're going to pay for this trillion-dollar new program. This program that encompasses some 1,990 pages in the House proposal. And as Leader McConnell said, it seems that it is the opinion of the majority of this chamber and of this Congress that the way that we're going to pay for this new entitlement program is to take money from health care for seniors. Frankly, Mr. President, it amazes me that we would have this conversation, that we would take nearly $500 billion, $500 billion out of health care for seniors. It amazes me for a couple of reasons. One, this money was money that was paid into the system by seniors out of their paychecks for their entire lives. This was not some handout from government. This is a program that they have paid into, and they expect a return on it. It is a covenant with our seniors. Our greatest generation, now retiring, we have told them that if they paid into this system, they would have the health care for the rest of their life through Medicare. And now, even though this program is in and of itself, as Leader McConnell said, in jeopardy of going bankrupt in the next few years, because less people will be paying in and more people will be taking out, we are going to take $500 billion out of this program to pay for a new program. That doesn't make any sense to me. Mr. President, I received a letter from one of my constituents, Shirley Anderson, from Gotha, Florida, which is right outside the Orlando area in Central Florida, and she gets it. She says to me, "I'm writing to express my deep concern about the proposed Medicare cuts in reimbursement rates for outpatient tests and for procedures. I understand that these cuts may force my doctors to either refuse to take care of me as I have Medicare or leave the state of Florida altogether. It has taken me a long time to find a doctor that I trust, and I cannot afford to lose him. If this happens, I will be forced to go to the hospital for those routine cardiac tests and procedures. My waiting times are going to be longer, and more important, my out-of-pocket expenses are going to be much higher, and I simply cannot afford this. I strongly believe that this is going to adversely affect my health care and well-being." Mr. President, what are we doing here? We're going to jeopardize the promises we've already made to seniors in order to create a new program that's not going to reduce the cost of health care for Americans, a new program that's fraught with problems. It doesn't make any sense to me. As was stated before, the proposal in the House and what we think will be the proposal in the Senate, although we've not seen the final copy, cuts $135 billion from Medicare Advantage, $150 billion from hospitals that care for seniors, $51 billion from home health agencies, and nearly $70 billion in additional cuts of fee increases. Well, what is this going to do to the process? I talked this morning to Ron Malone. He's the vice president of a healthcare services company that provides home health care in Florida. They have 60 locations. They have 2,000 clinicians. They serve about 25,000 patients. He told me that this proposal as written is going to put half of the providers underwater and out of business. Half of the home health providers, in his estimation, will go out of business. And which ones are going to go out of business, Mr. President? The small companies. The companies that we're trying to help in this economy where we have over 10% unemployment in Florida and nearly 10% unemployment in this country. We're going to put those small businesses out of business. And you know, home health care saves costs. Home health care is the more affordable option than a nursing home. Plus, seniors like it better because they get to stay in their own home. And we're going to put these people out of business. And as Senator Crapo said, where is this home health care most important? In areas where there's not a hospital or a nursing home available, out in the rural areas. Not only in places in Idaho, but places in Florida. So we're going to make it harder for seniors to get the care they want, and we're going to do something that ultimately is going to be more expensive. Mr. President, I want to also talk about Medicare Advantage. This is a program that was started to give seniors more options under Medicare. It's not a requirement, it's voluntary, they can choose it, and it's more like a private program. More like a program in the private sector where the companies actually cater to the seniors, provide them with more benefits like eyeglasses and dental care and hearing aids and flu shots. They have somebody on the other side of the equation who's trying to give them some service, unlike government usually does. And now we're going to cut that program. We have 915,000 Floridians in Medicare Advantage, and we're going to take $150 billion out of it. So what's going to happen? They're going to get less services. You can't get blood from a stone. When the money comes out of the program is going to suffer. And who's going to suffer? Our seniors. These are increasingly popular programs in Medicare Advantage. It's also important to note, Mr. President, that 40% of African Americans and 53% of Hispanics who do not have Medicaid or employer-based coverage are now enrolled in Medicare Advantage. Our minority populations enjoy this program also. So, Mr. President, as a senator from Florida, the state with the highest per capita population of seniors, the second highest total population of seniors in America, 3 million seniors on Medicare, who made this country what it is, who are our greatest generation, who paid into this system, and now are going to see less benefits and less care. I can't stand by and let that happen. What I'm afraid of, Mr. President, is we're going to go to a situation where we're going to have two classes of health care in this country. If we pass a bill like this, what worries me, Mr. President, is that less and less providers are going to be in the Medicare system because their reimbursement rates are going to have to go down. So our seniors and our disadvantaged are not going to get the best doctors. In fact, someday, I don't think that a lot of these doctors are even going to take insurance. So you're going to have one quality of health care for the rich and one quality of health care for everybody else. That's not American. That's not what we've promised our seniors, and it's not something that we should be doing. You know, the Hippocratic Oath tells doctors, first do no harm. Well, this proposal, from all that we can read about it, first does harm. And it harms our most vulnerable people, our seniors, who we owe and should respect. Mr. President, I yield the floor.
Mr. President.
Senator from Tennessee is recognized.
Mr. President, I thank the senator from Florida for his insightful